I am asked on daily basis, doctor, make me understand what is total cholesterol, what is HDL cholesterol, what is VLDL, and what is LDL cholesterol. Cholesterol is a very important for our cell membranes, our hormone production, vitamin D production, and digestion of food. Let's do a thought experiment that this body is like a city which has a lot of freeways, which are your bigger arteries. Then they divide into medium and smaller size roads and eventually to the street road, where these street roads on both sides there are houses, and in between the houses there are spaces. These smaller arteries are analogy of having the arterioles and capillaries, which are the last part of your vascular tree, and this cells or the houses analogy is for the endothelial cells, and there is spaces in between. Cholesterol is made up 80% in the liver and 20% comes from dietary sources. When it gets made, the first product out of liver as a factory to produce cholesterol is VLDL cholesterol, which is called very low density lipoprotein. It is a fat which is insoluble in water. It gets combined with lipoprotein, and we will give the analogy of vehicle which is giving a cargo. Not only on this lipoprotein vehicle, your cholesterol is get loaded, also the fats also gets loaded. So in this lipoprotein vehicle, metaphorically, you have two cargoes which are traveling. One is cholesterol, other is your fat. When VLDL loses some cholesterol out of it, it gets converted into LDL cholesterol, and that is the particle which is stays in our circulation for a long time, and it can carry or it can go deeper into our blood vessels. And when this cargo is too much or these vehicles are too much, they crash, accident happen, they get into the spaces in between those endothelial cells. When those LDL particles get into the spaces, the inflammatory cells come in and they try to clean up this mess, but they release a lot of chemicals and your cholesterol gets oxidized. More cells comes in and bigger inflammatory cells, macrophages comes in, they engulf it and they become foam cells. In that process, they're trying to clean, but they're getting bigger and bigger and clogging up those arteries. Once these arteries gets enough of it, we call it plaque, then body try to repair it by putting a scar tissue on it, and we call organized plaque, and that plaque is actually a stable plaque. But if nature cannot put a fibrous cap on it, then it will be loaded with the cholesterol, which once ruptures and gets into the circulation, it attracts another kind of cells which are platelets. They come in touch with the receptors on this fat and they become sticky and they try to clog up and repair. And in this process, they start cutting down the lumen of your artery, and then other proteins come in, and that's how you make the plaques. Liver also produces another vehicle we call towing truck analogy. They are the one, they go and pick up this debris or the bad cholesterol and bring it back to the liver factory to destroy them or use them or restore them or recirculate them depending on body's needs. But these two are very different lipoprotein. The LDL cholesterol is the one which is taking cargo away, and that is the one which crashes, makes plaques, and the HDL cholesterol is the one which brings. So intuitively you could understand that total cargo or total cholesterol which is being loaded on your VLDL cholesterol, very low density lipoprotein, then intermediary product ILDL, then the LDL cholesterol. That is your total cholesterol. And then what is hauled from your circulation back to the liver, that is loaded on your HDL cholesterol. The total cholesterol reading which you get on your blood test, that is the one which is loaded on VLDL, your ILDL, and your LDL cholesterol. And it does not tell you how many delivery trucks or how many small particles which can get into those spaces are available. And we could mark all of them. The VLDL, ILDL, and LDL cholesterol has a marker lipoprotein which is called ApoB. We could now in the lab measure ApoB, and that ApoB will give not only how much cargo which is floating around in the circulation which can lead to clogging of your artery, but how many vehicles are there, because they are the one ultimately have to get down into the spaces and create the plaque. So we could measure ApoB level, and also the similarly lipoprotein on HDL cholesterol is called ApoA1. We could measure the level of ApoA1 because when we do the blood work, HDL cholesterol is actually not calculated or not measured. Your total cholesterol is measured, and your triglycerides are measured, and your LDL cholesterol is measured. And then there is a mathematical formula which they apply. And this HDL cholesterol is a estimated number based on your triglycerides and LDL cholesterol. Now with the technology is advancing, because now we know that this is the marker on this vehicle for the HDL is ApoA1, and for all the one which are carrying the cholesterol is ApoB. So we could measure them in the lab, and we could risk stratify you about how much not only the cholesterol is circulating in your body, but how many vehicles are there. So qualitatively and quantitatively we could understand and make reasonable guesses about your total cholesterol, triglycerides, HDL cholesterol, and LDL cholesterol. In the lab, total cholesterol will give you an idea total cholesterol which is circulating in the body, but the way it's tested, it does not give you any idea about the number of vehicles or lipoprotein which are carrying. And then what are the kind of vehicles are they big strong vehicles, or they are small tiny vehicles which could be broken down or could deposited in those spaces. So knowing your ApoB and ApoA1, but in clinical practice, we struggle with people who are not even doing the basic stuff. That's why these things usually don't get checked. But if you have high risk or you have already established disease, you should ask your physician to check for ApoB level and ApoA1 level, because this will guide the precision of your cholesterol treatment better than what you have today. Thank you very much. I will see you in next video.